All right.
Okay, welcome back to Premed Office Hours. It is episode 170. If my math serves, that means we've been doing these for a little over 3 years now. It's amazing. When these started, they were Ask the Dean, and then it was Ask Mapped, and now it's Premed Office Hours. But it's always been the same thing. It's always live Q&A with people who understand the pre-med process inside and out. So it's a small team today. We typically try to have 3 people. Today, your experts in-house are Dina Golini. Thanks for throwing up that big comment.
Hi. Yeah, thank you.
Dina, so former senior admissions officer for Stanford, former assistant director of advising at Browns, Warren Alpert Medical School in their special master's program. How are you today?
I'm doing well. Really excited to be here today with you and excited for MapCon next week.
Me too. All right. And then if you don't know me, I'm Rachel Grubbs. I'm one of the MAPT co-founders along with Dr. Ryan Gray. And I've been helping pre-meds for a little over 20 years now on the MCAT and the pre-med process in general. So the way these sessions work is you type in your questions and we answer. As you may know, this is streaming to many channels. So you might be watching this on Facebook, on YouTube, on LinkedIn. You're not necessarily seeing all the questions that are coming in because they're coming in from lots of channels. But we get through as many as we can. So feel free to start typing in questions and we will select from the audience. All right, let's see what we have first here. Brian, hi Brian. He says, hi team, any advice for doing well in prereq courses as a non-trad coming back to school after graduating a few years ago? I'm beginning my prereqs from square one next semester and I'm anxious. Well, first of all, congratulations on going back to school. It's a really big step. That's really exciting. Dina, what do you think about this? Advice for a non-trad coming back to school after a few years?
Yeah, I mean, advice for doing well, just find what works for you because whatever grades you get in these courses is really going to matter for medical schools, and try to build relationships, especially with some of your professors where maybe you can get a letter of recommendation, from a more recent course since you've been out for a while. And I think just getting used to the pace of everything might be challenging, but you got this, and congrats for making the decision to go back and to start from square one. It's definitely not easy.
Agreed. Yeah, I love everything Dina said. One thing I'll add to it is, and I see this with many pre-meds, so it's not specific to you being a non-trad, is a lot of people, once they get to these collegiate STEM courses, start to sort of have doubt, right? So if you feel like this used to come to me more easily, does that mean you're rusty? Maybe. Does it just mean that college is a lot harder than high school, that college STEM courses are a lot harder than high school STEM courses, even if they're AP or IB? Yes, they go faster. And so I would say the other thing I would have you start to keep in mind is, what resources are you going to take advantage of to do your best, right? So maybe in the past, and I don't know you, Brian, but maybe you were someone who could go to class, read the notes, do the work, and get it. That's great if that's the case. But start thinking about, am I using Khan Academy? Am I using YouTube? Am I finding free peer tutoring on campus? That's often the case, that there's tutoring on campus that is included in your tuition. Like, start looking into what resources are available so that if you do start to fall behind, you don't wait until you get the D or an F on a midterm. You go, I struggled with 3 homeworks in a row. Clearly I need help. Go get it, right? So I think that's a huge mindset shift of, I can be an amazing student because I use all my resources, not just I'm an amazing student because I'm the only resource I need. All right, what's next? Dylan says, when should I consider the next application cycle? I currently only have 1 interview. I think my MCAT is the issue. Should I focus on the next cycle? What do you think here, Dana?
Well, first of all, only 1 interview is still good. It's an interview. There's so many students who get no interviews and have to apply for 2 or 3 cycles. So congratulations. All it takes is 1. All it takes is 1 interview, 1 acceptance. So try to really, instead of being negative about it, be positive about it and do the best that you can, prep, make sure that, that interview goes as best as possible. I would say that, definitely start thinking about next cycle, but maybe in like January, after you've had the opportunity to send any update letters, if schools will allow them. And then you can start I would start making a plan now if you think you have to retake the MCAT, because you want to plan ahead in terms of when you would do that, how you would study for that, getting letters of recommendation with current dates on them, by like February or March. So it's good to start thinking about it, but try not to be so negative where you feel like that is going to be the end all be all for you. It's a lot to take in, and try to think about two things at once, a current cycle and a future cycle, but you definitely have to be proactive and, just do what's good for you.
Well said. Oh, we got a two-parter, it looks like. Anna says, hi, I have a high undergrad GPA 3.9, but a low first year post-bacc 2.1. After I finish my second year of post-bacc, I'm not sure if I should apply to an SMP or continue undergraduate level science courses in my post-bacc. What would make the most sense to boost BCM grades? So it sounds like the question is, I'm already doing a post-bacc, but I feel like I might need more. Sounds like you're doing a structured post-bacc because you're saying first year, finish second year. What do you think about this, Dina?
I don't know. I think I need more context. I guess obviously academically capable with the 3.9 undergrad GPA, which is amazing. So I guess what other factors were involved with the 2.1 from your first year post-bacc? What's limiting you? Because an SMP is going to be, it's going to be rigorous and difficult. And if there were factors that contributed to you getting that lower post-bacc GPA, you don't want the same thing to happen again in an SMP program. So I think I would kind of just evaluate everything and see where you stand. An SMP program is great. I was assistant director of one. They're fantastic ways to just, take upper level, graduate level courses, get committee letters or letters of recommendation, and just demonstrate your commitment, your potential, your capability for medical school. But if you're going to run into the same problem as you did with your post-bacc, then I'm not sure if that's, the correct answer. I see another message in here from Anna. I took double the amount of coursework volunteer. Okay. Well, it seems like you overextended yourself. Yeah. Taking double amount of coursework, volunteering at 2 organizations, all are in charge. But that's going to happen in an SMP as well. I mean, when I worked for an SMP, those students were in M1 medical school courses while they were working in a federally qualified healthcare center, while they were doing a research project, while some of them were gaining experience in other areas like shadowing. So, that's going to happen in those programs as well. So I think you just have to do what's best for you in the long run.
Yep.
And if Rachel has any input.
Yeah, I think the only other thing I would add, Anna, is like I'm definitely perplexed by the 3.9 to 2.1, and I wonder, like, was that STEM related or not? So what you may want to consider is, like, again, we kind of have insufficient data here, is if you haven't already, go create a free account at Mapped and enter all of your courses from everything you've taken so far. So, dual enrollment, undergraduate, if you did any community college summer stuff, your post-bacc so far, and let us look at that trend with you. Everyone can create an account at Mapped for free. And then during your first couple of weeks, you'll have a free trial of the pro level where you can message with us. And it just sounds like, we need to do a little bit more analysis. Because I appreciate that you're planning ahead, but like rather than thinking about more post-bacc versus masters, I just want to think about what are you doing to get all A's this semester, right? Like I want to sort of pull you in a little bit and just have you focus on fixing it now. Hopefully not needing those extra years. All right, what's next? Brian again. Brian says, how can students prepare for future MCAT prep as they are completing their prereq courses? I'm planning on doing dedicated MCAT prep after all my prereqs are done by next spring. Yeah, this is a great question. So the MCAT is half, or actually roughly 60% critical reading, problem solving, scientific inquiry, and only about 40% knowledge. So yes, you need to complete prereqs in order to be ready to take the MCAT and handle that science knowledge. But I think the most important thing you can be doing to prepare for MCAT prep right now is continue to work on your critical reading skills. Again, I don't know you personally, Brian, but in my experience, many pre-meds work so hard on their science and math skills that they let their reading and writing skills just sort of go weak, right? And so I'm not talking about ability, I'm talking about training, right? Like if I go to the gym every day, then I know what my health is. But if I don't even go, then how do I know? And that's what I often see with MCAT prep is students will approach it as though it's a content exam and then be frustrated that they peak somewhere around 500, 505. And because that's typically all you're going to get with content, right? If you're trying to push into those kind of more competitive, 5.5 to 5.10, 5.10 to 5.15, maybe even 5.15 north, that's going to require a really strong content knowledge as well as critical reading. So if you can read a little bit of nonfiction, non-science every day, that's going to go a long way to helping you improve those skills. Good luck. Bernadette says, I'm not sure if an answer can be given for this due to how many other things can be considered in one's application, but what is considered a low MCAT score? Is it generally 505 and below? You did kind of answer your own question, Bernadette, which is there are many, many factors. Dina, what have you seen around this? I mean, I find most med schools do not give MCAT minima, probably for good reasons, but to the extent that they have an MCAT cutoff, have you seen numbers? Do you feel like is there a secret answer to this question, or does it really just depend?
I don't think there's a secret answer to the question. I think it just depends. It honestly just depends. It's some schools do have cutoffs, but for other schools, it really is a holistic process. Seen plenty of students in my career get interviews and acceptances below a 505, and then some above a 520 that got no interviews. So yeah, I think it's just making sure that you have everything that you need, and where there can be a holistic view and a holistic approach to evaluating your application.
Agreed. Peter Nananho. Peter, I haven't heard from you in a while. How are you? Peter says, I am halfway through my post-bacc program. They offer linkage programs. What do you think about this? Matriculation would be in 2024. Interviews start this October. My cumulative GPA is 3.4. Post-bacc cum is 3.87. I'm not sure what you say when you say, what do you think about this? Like, what am I supposed to think? Linkage programs sound great. You're already halfway through. Like, one of the things I typically say is don't sign up for a post-bacc just for the linkage until you've read all the fine print. Because often the linkage is you pay us $50,000 and we give you an interview. And I promise you do not need to pay $50,000 for an interview. All right. So I'm not sure if there's a specific concern or factor you want us to evaluate here, Peter. Let's see. All right, let's move on. And Peter, you can type in again if you want to clarify. Albert, hi Albert. Can you give me some tips on handling this weeding period, especially for we Texas applicants who mostly won't find out till February? The great Texas match. But yeah, whether or not you're in the Texas match system or you're just waiting on interviews, yes, I agree, Albert. This is the time of year when people are mostly waiting. Dina, what do you think here? You've seen people go through.
It's so frustrating. I mean, It's so frustrating. But schools have their reason, right? And I feel like I say this all the time on pre-med office hours, like there's so much going on behind the scenes. And, admissions has AdCom meetings like built out through the year, like who's interviewing on this day and assigned to this admissions committee. And, this is when we're going to release decisions. Like maybe it's once in the winter, maybe it's every 2 weeks, maybe it's every day after an admissions committee. It's just so school dependent, and it's very frustrating to wait, but it's normal. I will tell you that, Albert, it's normal. So don't think that you're the only one sitting back and just, on this waiting train. It's typical for every medical school. And I wish there was a better system in place in terms of, notifying applicants along the way, but it is what it is. It's all you can do is wait. And if you can do update letters, if schools will allow it, you can certainly do that, and just hope for the best.
Yeah. Those of you that have been around my sessions for a while know that I practice yoga. I do think anytime you have a lot of waiting, anytime you're out of control, that's a good time to practice your breathing and your meditation. It's a practice. It's not perfect. I'm not saying that's what you all have to go do, but yeah, if you're really stressed, it's good. It's a good time to think about mindful breathing. But yeah, waiting is normal. All right. Valerie says, if I take a second bachelor in nursing after my first bachelor, is that okay? This will not affect it. I just wanted to know how it's working in healthcare before really committing to this career. So a couple things here, Valerie. One is, I definitely agree you should know what it's like working in healthcare before you commit to this career. I wholeheartedly agree with the second part. I want to question the first part. Why go get a bachelor's in nursing if eventually you want to be a physician? Is it okay? Yeah, you can do whatever you want. You can get as much education as you want. I don't know what your first bachelor's was. In many cases, the sciences that you have to take for BSN do not qualify as pre-med prerequisites, because a lot of times those science courses are through the School of Nursing. And again, it's going to vary undergrad to undergrad. It's going to vary med school to med school in terms of what they accept. But oftentimes, your chemistry, your biochem, your orgo, your physics, you need to be taking those with other pre-meds, not pre-nursing students, because sometimes the curriculum is a little bit different. So what I wouldn't want you to do is do that thinking that's a shortcut to being pre-med when it is additional work. The other is, and again, if you want to get a bachelor's in nursing, go for it. I'm not telling you not to. You don't need a bachelor's in nursing to go get healthcare. Every single person who applies to med school in the United States is expected to have explored the career of medicine. So shadowing physicians, getting some kind of patient care experience. Again, you don't have to have a bachelor's in nursing to do that. You could get a med assistant job or a certified nurse assistant job, or be a phlebotomist, or be an EMT, or it can be paid. It doesn't have to be paid. You could continue doing whatever you're doing now to make money and go volunteer at hospice on the weekends. So yes, go explore healthcare before you commit, for sure. But I want to make sure that you've got a good reason for wanting to do the bachelor's, as opposed to thinking you need to pay for these 90 credits. And then depending on your situation, you still may need to go back to school again and take the pre-med prereqs. Like, let's try to be efficient about what we're doing here. Any other questions here? Let's see. Peter clarifies.
Peter, yeah.
My post-bacc is 100 per class. I work at Penn. The problem is that the Linkage program just started interviews, so we get into medical school in 2024. Isn't this too late? I mean, not confused. If they say it's not too late. Yeah, I'm still confused. The problem is the linkage.
Like, you would start medical school in 2024. Do you mean it is it too late to apply for the program if they've just started interviews? Peter, we need more.
Yeah, sorry, we're still not understanding what it is you're asking. Is it too late to apply to med school? Like, it seems like these are questions you need to either ask your linkage program or yeah, take a step out.
Or your post-bacc advisor.
Yeah. Yeah, we're having trouble following what you're going for here. All right. Any other questions? It's a little bit of a slower day today. I think people have like fall equinox doldrums. Let's talk for a minute about MapCon.
Yes.
I'm going to turn on screen share. So, can you guys see that? MapCon is a week from Friday. So Friday, October 6th. It's in the beautiful Inner Harbor area of Baltimore. I don't know how many of you have been to Baltimore before. I mean, the whole kind of Northeast corridor is one big urban sprawl, but that little pocket of downtown Baltimore right by the water is just so super beautiful. So I'm very excited to have our event be there, hoping we'll get some nice fall weather. And, you know, at these conferences, I always try to get out of the hotel at least a tiny bit. But yeah, Dina, you've been to a lot of different pre-health, pre-med conferences over the years. What do you think is a thing that's exciting for a student to consider if they're, especially for someone who's local, who can still maybe make a day trip or a train trip?
Yeah, I think it's just great to make connections. I tell the story all the time that that's how I met Dr. Gray, is at a conference. I would have never met him. So meeting people in person, and especially, you know, from MD, DO admissions, PA, just meeting people and talking about your experiences, gathering information, like it's just so worthy. You can't compare it to anything online, and just building relationships. You never know who you make a connection with that could open a door to something bigger.
Mm-hmm. Yeah, you guys can see, as Dana's been talking, I've been scrolling through this list. These are all schools who paid money to be there to meet you. So come hang out. There are admissions representatives who want to meet potential students. So I've heard Joanne Snap, who ran the UC Davis Health Pre-Health Fair for many, many years. She's helping us a little bit with MapCon this year. She's helping us a lot. I said a little in like, that was just a hyperbolic thing. She's helping us a ton. So anyway, Joanne has said before she thinks it's really useful to go to these events the year you're applying, because sometimes the person you meet is someone who read your secondaries a couple of weeks ago and can toggle you from got an interview invite to not. I've also heard other people talk, kind of to your point, Dina, about sometimes the value is in meeting people early. You never know what relationships are going to bloom later, right? Like the first time you met Ryan, you were just thinking about meeting a peer. You weren't thinking about maybe one day I'm going to work with that guy.
Did not think that at all.
No, it's just like, it's just leaving yourself open to what happens when I meet other great people who know things that I know, you know?
I also think it's nice to be around other pre-meds because it is such a stressful process. Mm-hmm. And just to meet other people who are also feeling the same things as you, like when Albert made the comment about waiting so long from Texas schools, just like kind of commiserating together in a way, and just talking it out and knowing that other pre-meds are hearing the same things, feeling the same things, I think just builds confidence throughout the process.
Yeah, definitely agree. So if you, students who are listening and watching today, if you're interested in going to MapCon, I think we'll give away a couple tickets today.
Great.
So we've given some tips. Why would you like to attend MapCon? Type in the chat. Let us know if you want a ticket at no cost, what you would do with it, what you would hope to get out of it. And we'll pick a couple from the audience and read them out. In the meantime, our friend Valerie has clarified. I'm doing a health science bachelor junior currently. I'm almost done with my prereqs for med school. I just want to explore nursing because I kind of had two interests. Okay, that's amazing. That's a really helpful clarification. So my gut here, Valerie, is you should go shadow some nurses and some physicians. Dina, what do you want to chime in here?
Yeah, definitely shadow, because they're very different, even though they're both in the health professions realm. And shadow, and just help, use that information to help guide your decision.
Yep. Yeah, and again, we're not telling you can't go get a bachelor's. I'm just not sure that's going to answer the questions you have. You don't want to know more about what school is like before these careers. You want to know about these careers. So I think the answer is more shadowing different types of people in healthcare. All right. And again, if you would like to go to MapCon, feel free to type in the chat and let us know. We've got one from Jay here. Oh, Joy. Sorry, Joy. Joy says, I'd like to attend to learn more about schools and decide which school is best for me. Great reason. You can also do a lot of research on schools at mapped.com, but it's never going to be the same as meeting someone in person. All right. Well, Joy, if you want to email us at info@map.com, so info@map.com, and make sure when you write in, say I was on Premed office hours and I want a MapCon ticket, and we will email you a coupon code so you can get yourself signed up.
We'll see you there.
Yeah. All right. Valerie follows up. I shadowed both of them and I like them. All right. You just got to keep doing more exploring. All right. Joy says, yay, thank you. Yes, you're very welcome. It's 1:27. We typically go for an hour for these, but maybe everyone's getting ready for midterms. Everyone's got the fall equinox doldrum. We can always cut off early if the popcorn's not popping.
I think we have one more question.
All right. Lorena says, hi, I'm doing a formal post-bacc. I got good grades for physics in undergrad. Should I retake it again since I took it back in 2019 and I'm applying 2024 cycle? Dina, there is this idea out there that prereqs expire. Well,
Yeah,
what's your experience with that?
No, they don't expire at all. Is there value in if you took undergrad prereqs 15 years ago in now taking some upper level graduate courses or a graduate post-bacc to just demonstrate more current academic ability to get those letters of recommendation, etc.? Yes, absolutely. But if you got a good grade in physics for undergrad, why would you take it again and put yourself through that with physics? Yeah. And congrats on doing the formal post-bacc. That's great.
Albert, who is in Application Academy, just reminded us, don't forget Application Academy sign up closes soon. It is awesome. Thank you, Albert. Yeah, so we tried something new this year. We typically don't start taking Application Academy students for the next year's cohort until November or January. And enough people have asked me every summer over the summer, why can't I start Academy in September, that I thought, well, okay, let's see. Some people have joined. There will be other registration windows. So although I definitely appreciate you reminding us, Albert, I don't know why I still have a picture on Dina. Just why not look at Dina? But yeah, if you want an early bird entrance into Academy, so there won't be any other chance to join for another like 6 to 8 weeks. So if you're interested in getting a jump on your personal statement, on your school list planning for it's funny, like med entry 2025 sounds a long way away. But if you want to start med school in 2025, you need to have personal statement, activities, school list, letters of rec, all of that done by May. You're going to have pre-writing secondaries hard on the heels. You're going to have to take maybe the Casper, the preview, like that to-do list is coming. So there is, depending on your life.
Fast and furious.
Sometimes it makes sense to start in the fall and chip away slow and steady. Some people won't start until January or February. That's still okay. Later than that, I start to get real nervous. Not that it's not possible, just not ideal. But But yeah, if you sign up for Application Academy in the next day or two, we'll give you 15 months access to make sure you're with us for all of next year's calendar year. And you get a 15-minute bonus call with one of the advisors. It's a great time to sign up if you know you're ready. So thanks for the plug, Albert. All right. Should I wait to register for Application Academy after MapCon? You don't need to. I mean, it's open right now. Registration is open right now for one more day, and then it's going to close again until around the Black Friday, Cyber Monday sales. So if you join now, the benefit is you're going to pay the same price that people pay later in the fall, but you're going to get 15 months access to both Med School HQ, like the portal, the Academy course, and also 15 months access to MAP, and you get a bonus 15-minute call. So if you know for sure you're applying next year and you're ready to get started, I mean,
and you want a seat.
Right. Early bird gets the worm, right? There's a reason we tried to make this early start sale really palatable. We think it's good for people to go slow and steady. Monica B says, does MCAT expire after a couple of years? Yes. Unlike prereqs, sometimes the MCAT does expire. And here's where it gets tricky, Monica. It's not one set expiration date. It's going to vary by med school. And some med schools measure based on when you apply, and some med schools measure based on when you matriculate. What I have figured is a good rule of thumb is you're always safe with 2 years, always with an asterisk, because never say always, and you are often safe for 3 years. Dina, you agree with that rough timeline?
Yes, I agree. But
more than that, maybe it's not time to take the MCAT yet.
School to school, some schools will say within, this is the last MCAT date we will accept prior to this matriculation, or, 2 years up until, it's definitely do your homework, but it does expire, unfortunately.
A couple other questions that came in about MapCon. So Joy said, are the first 600 registrant seats all taken for the networking lunch on Saturday? No, we are a little bit under that number still. So people who sign up today for MapCon can still join the networking lunch on Saturday. Fluffy, I think, is one of the people who won a ticket a week or two ago.
Fluffy, yes.
We always remember, one, because your name is Fluffy. Your handle is Fluffy. But then Ryan always comments on your, are you a Dallas Cowboy? Are you a Baltimore Raven? Maybe you're both. Jean, or maybe John, John, I'm gonna guess John. John wants to know, what is the price for Application Academy, and do you have a payment plan? Yeah, thanks for asking. I will happily go into a very brief sales pitch. So Academy is typically $599 for 12-month access, but we are doing a sale right now, so it's $499. And for this early bird sale that ends tomorrow, we're actually giving 15 months access. So lots of good reasons to go ahead and sign up today or tomorrow if you know you're applying next year and you know you want to work with us. So I'll put here in the chat, if you go to applicationacademy.com, and I think you have a banner if you want to throw up an applicationacademy.com banner, Alexis. So if you guys go there, you can see all the details of what's included. And there is a payment plan. So you can either do $499 one payment, or you can do 4 installments. So basically $125 a month. And then you can also notice, if you are someone who qualifies for fee assistance through AMCAS, we will also honor fee assistance here. So if you've already registered for AMCAS for the MCAT and gotten a fee waiver there, then if you show us that proof of a fee waiver, also for a COMAS, it's just that most people at this stage, a COMAS, you tend to get the waiver right when you're applying, where AMCAS, you tend to get it early. But so that gives you a chance for even bigger savings. Monica B says, is there a schedule out for Application Academy sessions? Yeah, we are working on the fall schedule right now, Monica, but basically it's going to be a much like it was this year, a mix of some weekday afternoons and then evening weekends. So we try to cover a variety of schedules. The sessions have gone up and down depending on the season. At some point this year, we were actually doing 17 sessions a week because demand was so high and attendance was so high. Our goal is to try to always keep those classes to be like high school classroom or smaller. We've actually been averaging like about 15 students per class. So we're really doing great in that regard. But there are certain times of the year where more people show up, more people have demands. And so we're always kind of watching that. So the schedule isn't static. It's not like if you can't do Tuesdays at 10 p.m. Eastern, then you can't make it, because there's always multiple sessions rotating constantly. So the idea is if we have, say, 10 sessions per week, you might be dropping in on 1 or 2 of them. And then they're all recorded. So if there's a session you really wanted to be at and you can't make it, you can always catch the replay. We post them within 24 hours. All right. Joy says, what would you recommend I do to get a letter of rec from a science professor if I've been out of undergrad for a little more than 5 years? Dina, you got that time machine handy?
Yeah, no.
What do you think here? I mean, this is a common predicament, right? So I'm poking gentle fun at Joy, but Joy, so many people go through what you're going through. How do I go back in time?
Yeah, I mean, you can try. If you've kept in touch with those professors and built a relationship, then that would make it a little bit easier. But if you haven't and you're just randomly contacting them and you're like, I had your class 5 years ago, it might be more difficult. So, I mean, I'm not sure if you're enrolled in any sort of post-bacc courses or graduate level courses. You might want to enroll in some so that you could get those letters. But I think, yeah, it's a tough question. And every single school has different policies, right? Like we need 2 professors from, hard science classes or humanities. So I think you just have to kind of do what's best for you. I don't know if Rachel has any other suggestions for it.
Yeah.
Even if you took 1 class somewhere, that would really, really help.
Yep. Yeah, and I think maybe this is part of why people think prereqs expire, is they realize, like, even if I don't have to retake that prereq, I just need to go get myself in front of some professors. So for those of you who are not in Joy's shoes, who have not been out of undergrad for a little more than 5 years, learn ye from this tricky situation. The time to start thinking about letters of rec for grad school, when you're at least in pre-med, pre-health, is freshman or sophomore year. You're not asking for the letters yet, but you're thinking, these are the people who may be writing letters for me in 3 or 4 years. What can I do to get to know them better, to learn more about their research, to come to their office hours, to find out what higher level courses they offer that I have to take anyway, so I can see you for Gen Chem and maybe also biochem in a year and a half. Like, start figuring out what you're going to do to build those relationships. And again, no shame to you, Joy, right? Because so many people go through what you're going through, but it's like my answer for this is always like, I wish I could have you have done it differently. But yeah, at this point, the best you could do is just reach out, right? And start to build the relationships now, right? Like, what's that old saying? Best time to plant a tree 20 years ago. Second best time to plant a tree today. Letters of rec are human connections, right? So a connection tends to, every once in a while we luck into it, right? You meet someone, and whether it's platonic or romantic, you just have an immediate rapport and everybody loves each other and everybody gets each other. But usually these things take time. So yeah, go start building that relationship. What would you say is the cutoff for MCAT and undergrad GPA before deciding to do a post-bacc?
That question. We can't answer that question.
Yeah.
No. There is no cutoff.
Not all GPAs are created equally, even if they have the same number, right? So if I tell you anything under a 3.3 needs a post-bacc, what if you got all Fs your first semester and nothing but 4.0 for the last 3.5 years? You don't need a post-bacc. I don't care that your QM is under 3.3, right? You've shown me that you had 1 bad semester and you're an amazing student. Versus, what if you're a 3.3, who got a whole bunch of 4.0s in dual enrollment when mom and dad were making you do homework and have gotten nothing but C's since you actually got to campus. Yeah, you need a lot, right? Even though your number might be the same. I mean, I just gave 2 random theoretical examples, right? But those 3 threes have nothing in common with each other. One, I mean, I still don't know whether or not they're ready for med school because I need to learn a whole lot of other things about them. But one of them has shown me that they don't know how to handle hard sciences. And one of them has showed me I had a blip and I got over it, right? So, sorry. That's why we can't answer. It just doesn't work that way.
And everybody's reason for, doing a post-bacc is different, whether like they've applied previous cycles and gotten feedback that they need, they do need to demonstrate a higher GPA, or they might need to work on their MCAT, or they need more clinical experience, or they need more research experience, or they've been out so long and they want the support of a committee letter process with the post-bacc. It's always different. So just understanding that like doing a post-bacc isn't automatically because you have a low MCAT and GPA.
Yeah.
I had plenty of students in my SMP program that had high GPAs for undergrad and just needed the program to support them in different ways.
Yep. Good point. Not all post-baccs are about GPA enhancement. Very good point. Jägenspaß? Yeah, I'm sorry. I'm laughing at my own, like, oh no, I don't know what to do with that line over the U. I'll have to Google that later. I wanted it to be like an umlaut. Is volunteering at a hospital considered clinical work? I had contact with patients as I had to do rounds and keep them company. This is a need more information question. I don't know what you did at the hospital. Now, you said you had contact with patients as you had to do rounds, but what if your rounds were going around with a clipboard taking insurance? That's not clinical, right? And so clinical is not about whether or not you're at a hospital or at a clinic. Clinical can happen anywhere. Clinical is about whether or not you're interacting with the patients in a way directly related to their health. So what I don't know, Yugen, is like, were you taking vitals? Were you feeding them? Were you, cleaning bedpans? Or were you going around and taking insurance information, right? Like, I don't know if your work was admin or healthcare related. So that's the important thing with clinical, is not where you were, not what the job title was, but what those day-to-day, hour-to-hour activities looked like.
It's your favorite question, Rachel.
It's a common one.
Because,
Is it clinical? We did buy isitclinical.com. It's just a landing page, but one day we're going to make a magic like widget quiz, because every time I say it takes
love that idea.
Decide for yourself, people go, no, just tell me. Well, I will say I want some future physicians who want to do some critical thinking. Let's see. What's next? As a non-traditional student, the doctors I work with are willing to write a rec letter. My managers of volunteering place are also willing. Should I consider all of them plus the committee letter? So
there's a second part too. Yeah. Do I have to pick and choose because I have good relationships with all of them?
So it sounds like she's talking, Lorena, if I'm reading you correctly, you're talking about kind of creating your own version of a committee letter, right? Like essentially making like a committee letter that's lots of people I worked for.
Because if you're looking for letters from the doctors you work with, those are considered, letters from a physician demonstrating like clinical, which would be part of your committee letter. So yeah, first you need to look at letter requirements for schools. Some schools, if you are submitting a committee letter, it can't have more than like 4 letters attached to it, and that meets the letter requirement. Or sometimes it can't have more than 5 letters attached to a committee letter, or 3. Mm-hmm. So you need to look at that. Some won't accept additional letters outside of the committee letter. Some will, if you don't have a committee letter, it's up to 6 individual letters. So I think you don't want to go over whatever the committee letter requirements are for each school. It looks like there's another response. I'm doing a formal post-bacc, so the committee letters from the school. So then whatever letters you're getting from your doctor's office would go to whoever's writing your committee letter and get attached as part of your committee letter. Yeah, I don't know. I'm a little confused with it, but
yeah, Lorena, it sounds like we're missing context of the way your school is handling the committee letter. Like, are they doing a packet where they're adding other letters? Are they just looking at letters and just submitting one joint? If you are in a situation where you have more people who could potentially write you a letter than you need, that's a very good problem to have. I think what you want to think about then is like, who's going to communicate strongly. I personally think 1 or 2 personal heartfelt letters are going to be much more powerful than some generic we statement letter with 6 names at the bottom. Because my guess is that even though you're thinking all those names, all those letters at the end of the names, I'm going to think none of those 6 people knew her well enough to write a letter individually, right? I'm not going to see that as a big compliment. And so I think it's one person's opinion. Other people could disagree with, right? I'm not, just because I stated that doesn't mean that's definitively the fact. But I personally would rather read a letter from someone who knows you really well, who has very strong things to say about you, and ideally is also a strong writer, right? I mean, with love, I bet you some of those people that adore you aren't great communicators. Don't pick them. Pick the person who knows how awesome you are and is also really awesome at talking and writing. It'll help you narrow it down.
You want depth of information, quantitative, people who are going to say, like, this is the best medical assistant I've worked with in the top 1% in my entire 30-year career. You don't just want letters for the sake of having letters. It's not going to do anything for you.
Yeah, and again, Dina kind of touched on this briefly, but many med schools have upper limits. And this is not one of those things where if 6 is good, 16 must be better. Like, no, don't do that. Send them up to as many as is allowed and stop there. I know that gets a little tricky with a COMIS, because a COMIS, like, you just attach all your letters and then they all go to O schools. So I understand sometimes with a COMIS, because if one school says I need 5 and the other school says no more than 3, like, that's trickier, right? But for AMCAS, because you can assign specific to school, you always want to give them in the target range, but never more than their max. All right. Time for 1 or 2 more. Is a psychometrist that gives tests for ADHD learning disability, takes patient history under a psychologist, considered clinical for med school? Monica, let's use some critical thinking. I take it this is a role you're doing. What are you doing with the patients? You say you're giving tests. You say you're taking patient history. Are you interacting with the person in a way directly related to their health? What do you think? Do you think this is clinical? If you're worried it's not clinical, why? Tell me what do you think is potentially about this role making it not going to qualify for clinical? This isn't a quiz. I'm just trying to kind of help you walk yourself to, my guess is you know the answer. Either Monica got distracted or she's feeling very shy. All right, let's give her a minute to come back. I'll take this one from Taylor. Is 6 months enough time to build a robust application? I don't know what this question means, Taylor.
Me neither.
Are you saying, I just decided today that I want to be a
today,
and I intend to apply in May, which is actually more like 7 or 8 months away. So between now and May, I'm going to do everything I need to do to become a pre-med and apply to med school? My answer is no, that's not enough time.
No, it's not enough time.
If you have already taken 2 to 3 years of pre-medical requisites, if you've already been exploring shadowing and clinical and community service and research, and you've been walking the pre-med path, and what you're asking is 6 months enough time for me to plan out my school list, pre-write secondaries, write a personal statement, write activities essays? Yeah. But when you say build a robust application, to me, part of building an application is, that's not just the filling out the forms, that's the 3 years leading up to actually applying. And so sorry if I'm giving you kind of like a highly literal answer to your question, but I want to make that distinction because I think it matters a lot. Tyler says, I have all my coursework done. My activities don't directly apply though. That makes me nervous. I mean, is it too late? Not necessarily, but if you've done no clinical at all, so you're going to apply, and again, I don't know your situation, but it sounds like you're hoping to apply in May. So if you're going to apply in May, most people start writing their personal statement sometime in January or February. So you need enough shadowing and clinical in the next 4 or 5 months that after the new year, you can start reflecting on it and go, okay, I've put myself through the enormous challenge that is pre-med. I'm ready to sign on for med school, which is pre-med 2.0, really probably maybe pre-med to the power of 2, right? Yeah. It's going to be even harder, faster coursework, more volunteering, more clinical, more research, more schmoozing at clerkships to get letters of rec to get your residency. Then after that, you're going to work in the hospital like 80, 100 hours a week for 60 grand a year. So technically you're not poor, but you're going to make less than minimum wage. I mean, like, you know, right? I'm not trying to bum you out. You are signing on for something that is ultimately very rewarding, but is going to be extremely challenging for the next many years. You must have a reason. And so that's my question is, have you done enough exploring of healthcare that you can write essays and convince me that you know why you want to be a doctor? And maybe you can. I'm not saying you can't. I'm saying if you say my activities don't directly apply, I don't know how by May you're going to be able to tell me a story that says this is why I am completely ready for both the joys and the hardships of being a physician. I know what it's like to, you know, be in situations where patients' parents or patients' spouses are yelling at me because they're scared and stressed, not that I did anything wrong. I can keep my cool when someone needs bedpan changes and not make them feel shame because that's just like, have you lived through the day in and day out of it?
And you need enough activities. Like, I've read applications, trust me, where people list 4 activities, 3 activities. And it's like, why are you applying to medical school? You need to have enough depth, like Rachel said, to actually fill out the application and have what you need. So if you don't have any directly related activities, then I think you might need a little more time.
Yep.
Yeah.
Okay, Monica has come back.
Monica's back.
Monica, thank you so much for being brave, right? Because so just as a context, her question was, if I'm doing this psychometric work, does that count as clinical? And her answer is, yeah, I think it is clinical, but I'm concerned that it's under a psychologist, not an MD. Yeah. And that's actually exactly what I would have said. Is sure it counts as clinical, and can you also go get some clinical where you're around
doctors,
around some doctors? But I would count it. I just hope it's not your only clinical. A+, Monica, you knew your own answer. Gold star for you. This is part of why I like to do those exercises. I know it's painful, but you guys think you need us to weigh in, and you just like to hear
you have the answers.
You. Yeah. All right, it's 1:54. We're coming to the end of the hour here. Again, if you are not signed up for MapCon, it is not too late. We are doing a 50% off last minute sale. So you can go to mapcon.com and use the ticket coupon. I'll be there to save.
I'll be there.
I'll be there. Dr.
We'll all
Gray
be there.
Verinia Grant will be there. Courtney, we're going to have all these amazing physicians, podiatrists, pharmacists, physician assistants, people from schools across the nation. It's going to be amazing. So yeah, I hope that for those of you that are up for a little road trip or train trip to Baltimore, that we'll see you next weekend. It's not too late to make that happen. All right, friends. And speaking of which,
questions.
Yeah, I think no pre-med office hours next week because we will be all of us will be en route to Baltimore. Right. So if you want, if you want to ask us questions next week, you've got to do it in person in Baltimore. Otherwise, we'll see you in 2 Wednesdays. Take care, everybody.